everybody, my name is Jeannie Rouse and I am a student with Indiana State University with the LPN to BSN program. I'm doing a video presentation today about hormone injection teaching in relation to transgender health medication. It's specifically tailored to those medications that they are using. Before you do this presentation, there is a pre and a post test at the comment section down below if you want to click on that just to assess your knowledge. There also is a flyer just in case you want to hand out some information and have this presentation. So these are the learning objectives that we're going to go through. At the end of this presentation, you will be able to describe the changes to your body from hormone replacement therapy. You should be able to explain what a subcutaneous injection is. You should be able to list supplies needed to perform a subcutaneous injection. You should be able to describe the steps taken to perform a sub-Q injection. You should be able to illustrate how to dispose of used injection materials. You should be able to identify some common reactions and ways to treat them. And then you should be able to recommend additional resources for care. There are two types of hormones that are used for hormone replacement therapy for transgender individuals. One is called estriadiol, and that's used for feminization. The other one is testosterone, and it's used for masculinization. Underneath here, you can see that I listed like bodily changes. Your physician should have gone over all of these in great detail prior to starting you on this medication. Obviously, if you have any questions or concerns, it is recommended that you call your healthcare provider who has prescribed this for you. So what is a sub-Q injection? So it's when the medication is injected into the fatty tissue right underneath your skin. It's placed at a 45-degree angle, usually depending on how much sub-Q tissue is present, and you use a small gauge needle, about a 25 gauge, 5/8 inch needle. So 45 degrees is coming in like this way right here, and you're just going to want it in like the sub-Q tissue, which is this area here. So when you look at this, this is the angle that you would want to start right here, kind of going in at an angle right there. And then these are the supplies that you will have to gather. Usually there's a list that you can get from your provider, but these are just syringes, either 3 ml or 1 ml, depending on the dose of your medication. You'll need alcohol swabs, which are right here, and that's to clean the injection site. You'll need two different size needles. You'll need an 18 gauge needle, which are these pink ones here. The medication is very thick and hard to get out of the bottle using the standard sub-Q needle. And these are the smaller 5/8 inch needle. And then usually when you get a sharps container, it's going to be red. I've only ever seen yellow used with chemo medications, so it's most likely going to be a red sharps container. Very important to get. So when you prepare for the injection, what you're going to want to do is wash your hands before you do anything, but you're going to take the medication out of the box, pop off the little lid, you're going to take your syringe and you're going to attach it to the 18 gauge needle, being careful not to touch the end of the syringe or the end of the needle. You don't want to contaminate that. Then what you're going to want to do is inject air into the vial. So if your dose is 0.25 mLs, you're going to pull out 0.25 mLs of air. You're going to stick the syringe into the stopper. You're going to inject the air into the bottle here. And then you're going to turn it upside down and you're going to draw out the 0.25 medication dose. And then when you're going to inject your medication, you have a bunch of different sites. You could do the back of the arm, you could do the front of the abdomen, you could do the lateral thighs. It's very important that you rotate sites. So every time you give an injection, you want to choose a different site. Do not use the same area every single time. It's very important to switch sides. And like I said, a 45-degree angle right into the subcutaneous layer. So what you're going to want to do is pinch your skin about 1 inch with your thumb and forefinger of your opposite hand. Hold the syringe in your dominant hand, and you're going to come in at a 45-degree angle. Push the needle in real good. Then you're going to push down on the plunger gently, and it might take a little bit. Like I said, the medication is very thick, so just go down, inject the entire amount of medication, pull out your needle and then use a gauze pad or a cotton ball and place it on the site just in case there's any kind of potential bleeding. And then what you're going to want to do with your syringe and needle is do not recap it. Place it into your sharps container. If you have safety glide needles, definitely pull the safety glide to cover the needle prior to putting it into the sharps container. So here's some pictures here. This is a good illustration of a 45-degree angle. They're pinching their skin right here. This is what it's going to look like when you pinch your skin a little bit. Make sure that when you pinch your skin, you're not grabbing like a huge fat wad of muscle. You just want kind of like the soft, tender, flubby part of like your arm or your abdomen or your leg. So definitely just find some sites that are just a little bit more fattier than others. And then disposing of the needles. So like I said, do not recap your used needle. Don't throw them in the trash. Don't throw them in the toilet. Make sure you keep this sharps container and all medications, all of the needle supplies, everything out of reach of children, preferably in a locked cabinet up very high. Don't throw the sharps container once it's full in the trash. Don't throw it in the dumpster. You have to take those to a medical waste facility. There are places that take back full sharps containers and you can exchange them for new ones. Most pharmacies like Fred Meyer's, Walgreens. You can also call your county's hazardous waste center. Multnomah County does have needle and sharps container drop-off boxes within the city. You can go online and check out those locations. Commonly seen reactions, sometimes patients will say that they get an itching or burning at the injection site. Usually if you apply ice to the area you want to inject prior to administering, that will help get rid of that sensation. Definitely notify the pharmacy or your doctor if you are allergic to sesame. Testosterone specifically is suspended in sesame oil, so you don't really want to be injecting yourself with that. Sometimes when you pull the needle out, you could have a little bit of bleeding. It's very rare just because you're in the sub-Q, but you might nick a little bit of like a capillary bed. Just apply pressure and put a Band-Aid on there. Don't worry about it too much. You're not going to bleed out. This is additional resources for additional care, specifically for transgender individuals. We have this website here for just sharps container disposal. This one right here is a more in-depth step-by-step guide of how to give hormone injections. You can get it from Fenway Health. They're one of the top facilities for transgender health. This right here should have a list of Portland's gender-affirming healthcare clinics. I do know Planned Parenthood, if you do not have insurance and are needing your hormone medications, Planned Parenthood will refill your hormone medications if you do not have health insurance. So never feel like you don't have access to your medications. There's also a trans lifeline here just in case you need any kind of support or resources, any kind of mental health stuff. And then we also have the National Queer and Trans Therapist of For Color. This is their email, and they have a PO box, but they help service trans and queer people of color across the United States, just in case you need someone who is more ethnically orientated to you. And then these are some references that I gathered at the end to get my information. These are just some evidence-based practices saying of like how you could do subcutaneous injections in the calf, and that subcutaneous injections of hormones is okay and it's safe. So thanks for taking this time for doing my presentation. Thanks, everyone.